So let's talk about acetaminophen. You probably know it as the active ingredient in Tylenol. For decades, it's been the one pain reliever that doctors said was totally fine to take during pregnancy. But that long-held belief might be changing. A whole lot of new research is forcing us to take a much closer look. So here's the big question, right? Could the world's most common, most trusted, seemingly harmless pain reliever actually carry a hidden risk for a developing baby? I mean, this is a huge deal because we're talking about one of the most critical periods of human development. And to get a sense of the stakes, you have to understand just how universal this stuff is. We're talking more than half of all pregnant women, all across the globe. For generations, this has been the default, the go-to, the one thing everyone felt comfortable with for pain or fever, precisely because it was seen as so safe. But recently, that solid ground has started to feel a little shaky. A growing number of scientists have started raising a warning flag. And a big reason why is because this new scrutiny is happening at the very same time we're seeing this, honestly staggering rise in neurodevelopmental disorders in kids. Just look at this number. From 2010 to 2020, in just 10 years, the rate of autism spectrum disorder diagnoses in the US shot up by 98%. It basically doubled, making it the fastest growing developmental disorder out there. And it's not just ASD. In a pretty similar time frame, ADHD diagnoses climbed by 36%. Now look, we all know the old saying, correlation isn't causation, and that's true. But when you see two trend lines moving up together this dramatically, you can understand why scientists are starting to say, hey, maybe we should look into this. And these weren't just a few whispers in the dark. These concerns got so significant that in 2021, a group of 91 experts, we're talking scientists, clinicians, public health pros from all over the world, they all signed on to this consensus statement. And their message was very clear. We need to hit pause and reevaluate how casually this drug is being used during pregnancy. Okay, so what exactly did they see that was so concerning? What evidence prompted such a loud and public warning? Let's dive into the key studies that are actually pointing to a potential connection. So for a long time, the research here was kind of weak. It mostly relied on asking moms to remember if they took Tylenol months or even years ago, which is tricky. But the newer studies, they changed the game. They used biomarkers, actual physical evidence of the drug in a newborn system. They tested umbilical cord blood and even meconium, which is a baby's first stool. And what they found was really consistent, a strong dose-dependent link. In other words, the more of the drug they found, the higher the child's risk for ASD and ADHD seemed to be. And this chart from that Johns Hopkins study really brings it to life. Just look at these numbers. For the children in the group with the highest exposure, their risk of an autism diagnosis was 3.62 times higher. For ADHD, it was 2.86 times higher. I mean, those are not small numbers. That's the kind of data that makes you sit up and pay attention. And it's not just one or two studies pointing this way. A huge new review looked at the entire body of evidence, 46 different studies. And the pattern held up across the board, a consistent positive association for ADHD, ASD, and other neurodevelopmental issues. But here's the real kicker. The review found that the better designed a study was, the higher its quality, the more likely it was to show this link. That's a really important clue. But this is science, so it is never that simple. The story is far from settled, and to get the whole picture, you absolutely have to look at the significant research that found no connection at all. And this really gets to the heart of the whole debate. In 2024, a massive study came out of Sweden. They looked at nearly 2.5 million kids, and they used this really clever method where they compared siblings. By looking at a brother and sister from the same family, you can control for a ton of shared genetic and environmental factors. And when they did that, the link to autism and ADHD just vanished. It suggested that something else, some family factor, was the real cause, not the drug. However, other scientists were quick to point out some major limitations. For one, the Swedish study couldn't really track the dose. It mostly just looked at prescriptions, which means it missed all the over-the-counter use. I mean, it only reported a 7.5% usage rate when we know the global average is over 50%. That suggests they missed a massive amount of exposure. And that's a critical flaw, especially when all the other evidence says the risk is tied directly to the dose. Okay, so let's set aside the conflicting studies for a minute and just ask a basic question. Is there a plausible biological story here? Like, how could a common painkiller possibly affect a developing brain in the first place?
Well, it turns out there's a theory. When your body processes acetaminophen, most of it is harmless, but a small fraction, about 5 to 10%, gets converted into a toxic substance called NAPQ. Normally, your body has a defense for this, a super antioxidant called glutathione that neutralizes it. But if you take high or frequent doses, you can actually use up your glutathione stores. And when that defense system is down, NAPQ is free to go around and damage cells.
This whole situation is called oxidative stress, and the main target for NAPQ seems to be the mitochondria. You know, the tiny power plants inside every cell. Now, a developing fetal brain is one of the most energy-hungry organs there is, which makes its mitochondria incredibly active and incredibly vulnerable. And here's where it all connects. A whole other field of research has already found strong links between mitochondrial problems and both ASD and ADHD. I think this quote from Dr. Edward Hallowell is a fantastic way to think about the potential impact. He describes ADHD not as an attention deficit, but as having a Ferrari engine for a brain with bicycle brakes. It's not a problem of power, it's a problem of regulation. And that analogy really helps you imagine how metabolic stress during that critical phase when the brain's braking system is being built could have a lasting effect. Okay, so we've looked at the evidence for a link, the evidence against it, and a plausible story for how it could happen. So after all that, what's the bottom line? Where do things actually stand right now? The first thing to say is that causation has absolutely not been proven. The scientific bar for that is incredibly high, and we're not there. There's no single smoking gun. But the overall pattern across dozens of high-quality studies, that has been enough to convince a large part of the scientific community that there's a plausible risk here, one that demands our attention. So what does this all mean in the real world? This is really important. This is not a call to ban acetaminophen. Experts are very clear that untreated high fever or severe pain can also be risky during pregnancy. The call is for a shift in thinking. It's about moving away from viewing this drug as totally harmless, and instead using it more cautiously. The advice is really simple. Use it only when you really need it at the lowest dose that works for the shortest time possible. And always, always talk to your doctor first. Ultimately, the goal of the scientists raising this alarm isn't to scare anyone. It's to empower them. As Dr. Ann Bauer, one of the co-authors of that big consensus statement, put it, the evidence is now strong enough that we should be warning women to be more cautious. It's about giving them the information so they can have a real, informed conversation and make the right choice for them. And that's where this complex debate stands today. There are no easy answers here. Just a really common drug at the center of a huge scientific question, forcing us all to think about how we balance risk, safety, and precaution during one of the most important stages of life.